cardiologist Dr. Fahmi Farah. Good morning, doctor. With this heat wave in Texas right now, how would you advise people to stay healthy during this time?
Good morning. Thanks for having me. Yes, this is a very hot time of the year, especially in Texas, temperatures rising as high as 115 with heat index, dangerously high temperature to be exposed outdoors. So my advice, first of all, would be to minimize your outdoor exposure, stay hydrated, and if you're experiencing hyperthermia, remove yourself from that heat and call for help.
So what are some of the specific symptoms or signals from our bodies that we should pay attention to while we're outside and then we should react to?
Some of the common symptoms would be extreme fatigue, feeling lightheaded or dizzy, and the sense of feeling like you're going to pass out. Any of those should alarm you to seek help and to get yourself out of that heat and start hydrating and cooling off.
Oh, those are very important points. Now, I understand that you are in Texas, right? So what is your experience these days? Have you been seeing more patients recently with that heat wave or any changes in your daily work at the moment?
We've been noticing some subtle changes. I am a cardiologist, so I see patients in the clinic primarily, and a lot of patients are coming in with really high blood pressure and elevated heart rate. And I ask them what happened. This is very different from before, and they'll say, I just came from the outside heat. So yes, we do see an immediate effect on your health, especially in your vital signs with blood pressure and heart rate.
Oh, wow. Okay. And on top of this, now many areas have air quality warnings still from the smoke coming from Canada. Now, how can we protect ourselves here?
Yes, air pollution definitely is a concern, and I will say that air pollution does play a role in your overall health, and especially your cardiovascular health. It does increase the risk of having coronary artery disease and heart attack and things like that. So very important to minimize that exposure. Staying out indoors is the key, especially in areas that are highly affected like the north and the northeast.
How much exposure will lead to those serious health issues? Like when will we actually start seeing serious health issues when we are living in those areas?
So there's a twofold answer to this. One is that there's an immediate impact that could happen with not very long of an exposure, like 15 to 20-minute exposure can cause somebody to have some of the symptoms that I described earlier. But it can also lead to something called heat stroke. That's in the acute setting. Heat stroke is a very scary thing. It's when our body goes into hyperthermia, and we can have end organ damage. So we can sustain damage to our kidneys, liver, heart, all of those things. And it can lead to something like passing out, cardiac arrest, heart attack, all of those scary things. But then there's a cumulative effect, and this has to do more with air pollution. That usually takes a little bit of time. So over a course of years, it can have that lingering effect on your heart and your coronary artery system and accelerate that plaque building process.
Thank you so much, Dr. Fahmi Farah. I really appreciate your time today.
Thank you for having me. It was my pleasure.